We will be starting very soon. Thumbs up from some of my fellow panelists if you can hear me. Okay, thank you. Good morning, everyone, and welcome to today's first Outreach Connection webinar for certified childcare centers from our Childcare Center Licensing Unit and team. We want to welcome everyone and give a little bit of time for people to sign in. We know it's just 11 o'clock now, but we have a lot of information to provide, so we will start very soon. Give it a few more, maybe 30 seconds or so. I'll watch for that clock. While we wait, you can see here that we have numerous speakers with information to share to you. So again, we're gonna get started now. I think we've got, people can continue to sign in. We just, again, we have a lot of information to provide. So we're going to get started. So again, welcome to the Child Care Center Certification Outreach Connection for October of 2024. I am Lisa Mills. I am a training specialist and today's host from the Child Care Center Licensing Unit within the licensing division of the Minnesota Department of Human Services. First, I would like to thank all of you for being here with us today. And also we all, our entire team here want to wish you a great thank you for all of the hard work that you do throughout the state to support children and families. In the capacity that we all have in our various jobs, we see the work and the dedication you have. And again, we like to take the opportunity to tell you thank you. And again, thank you for being here to listen to us. Outreach Connection webinars are new for Certified. This is our first one that we are launching today in October of 2024. But our Child Care Center Licensing and Certification Unit has been providing Outreach Connection webinars for our licensed providers for about a year and a half now. And we as a licensing and certification team have worked really hard to bring relevant information together from us and some of our state partners to make certain that you're hearing information and updates directly from us, in addition to other ways that we communicate information, such as through our GovDelivery emails and or on our website. But again, we work really hard to connect. We love to hear feedback from you, and we take that feedback and we share it within our partnership with other state agency partners that are working to support the industry. And because of that, we have put together this outreach connection as another opportunity for us to communicate with all of you and to share information and make ourselves available. So today we just really want you to know that this is a way for us to further connect with you and provide you with what we think might be useful information to you. Little housekeeping before I pass things on to our numerous speakers. I have added the link to the handout that we've created for today's session. In that handout, you will find links to the numerous sites that we might reference in today's presentation. And so the handout is available. There's, again, I put the link in the chat, but it's also available and will remain available on the Child Care Center certification website for a short time so that you can have access to some of the resources and the links that we will be talking about. Today's webinar is being recorded, and our goal is to once that recording is finished, we will send it off to a third-party vendor that we work closely with to ensure that we are transcribing it and having it captioned. And once we get that back, we plan to post a recording of today's session on the Child Care Center, not licensing webpage, but the certification webpage. My first day that I found up my own slide. So sorry. But we do also encourage you to ask questions to our panel in the chat. Today, we have numerous people from all of the different speakers here to help answer questions. The chat, you can place a chat in there to the panel so that our panel can see them, and they will do their best to answer any questions that come in through today's chat. We would, pending time, they may also have time at the end of today's presentation for any of those questions that come in. So you might hear from them there as well. And now our agenda for today, for this morning, we have heard from certification holders that there are certain topics that they like to hear about and that they want to know more about. And so with so much going on in our industry right now, we again take that feedback very seriously and have compiled a group of speakers today that will share with you information about current legislation that occurred in 2024. So we're going to hear from Karen Kunze, who is one of our licensing policy, legislation, and stakeholder engagement analysts or specialists. And then Carrie Leith is a certification supervisor from our Child Care Center licensing unit. And they will again talk about legislation that occurred and should be in place this year, 2024. And then Karen is going to share with us some potential 2025 legislative proposals. And then we have John Sill. John is a Provider Hub product manager with the Systems Transformation, or better known in outside circles as the Provider Hub. So he's going to share with us some information about the Provider Hub. Dana Ellingson works with the Great Start Compensation Support Payment Program, and she is here to share information about that program, the Great Start Compensation Payment Program plan. Always a favorite at all of our outreach sessions or any connection we make with our providers is to hear from background studies. And so Jana Nicolaisen is here. She is one of the research and operation area managers from background studies, and she's going to share some information and reminders with you for that. And then Michelle Hatlily is one of our certification licensors in our Child Care Center licensing and certification unit. And she has a few reminders to just share with you, again, based on feedback we've heard or seen in programs. She's got some little updates or actually rather reminders to share. So I'm going to first open up things. I'm going to turn off mute for Karen and Carrie to share with you about, again, legislation 2024.
Great, thanks, Lisa. Good morning, everyone. Like Lisa said, I'm Karen Kunze, and I'm here to talk about some 2024 legislative changes. Just a reminder that earlier this summer, on August 8th, we sent out our 2024 legislative implementation plan. So that goes through all of the things that passed this session and what you need to do to prepare to change, what changes you need to make to implement those changes. It's available on the Certified Center website in 2 different places. The link, I'll also put the link in the chat, and it's also available on the handout that Lisa has prepared. So just in case you need easy access to it, those are the places where you can find it. There are various effective dates for the legislative changes this year, but many of them did become effective October 1 of this year. So it is important to be aware of those changes. Next slide. And I'll turn it over to Carrie.
Yes, thanks, Karen. Yes, I'm Carrie Leith, the supervisor for certified programs. We wanted to call out specifically a couple of the changes to the 2024 legislation, and one of them is the conditional certification. So previously, DHS had the authority to issue a correction order or to decertify a program. Those were our 2 options. We now have the authority to issue a conditional certification when certification violations require more serious action than a correction order, but it does not fall to the level of decertifying a program. If a conditional certification is issued, the center will be required to follow specific terms related to the non-compliance that we had observed and cited for on the last visit. In addition to that, we will also be checking for compliance of all certification requirements throughout the time that you're on the conditional certification. Licensors will monitor the specific terms of the conditional and then conduct more frequent visits that will be unannounced visits throughout the year while you're on the conditional. And this will allow the licensor to provide more assistance and to help you maintain that compliance. Lisa, you can turn to the next slide, please. The other thing that we wanted to talk about is child records. So in the 2024 legislative changes, we have added some child record items that are new to us. Unfortunately, that was passed through 142C, which will come into implementation when we transfer over to our new department, DCYF, the Department of Children, Youth, and Families, which we anticipate sometime in June and July that we will do that. So in the meantime, licensors, when they're out doing your annual review, they will be giving you technical assistance. They'll be looking for these items and giving technical assistance for those. The one thing I do want to point out is that the immunization information does need to be available to staff at all times of operation. So if currently if you're in a school and the school nurse is the one who has access to the immunizations, if the school nurse is not on site and staff do not have access at that point, you will need to have a plan in place on how you can get access to those. And again, licensors will be issuing technical assistance on all of these until we transfer over to DCYF. Lisa, you can go on to the next slide. Thanks.
All right, so now shifting gears, talking about our 2025 potential ideas. And next slide. So right now we're in the development process of coming up with proposals for the next legislative session. The language I'm going to be sharing today, keep in mind it's just a draft. We're still in discussion and looking for feedback, and we'll make adjustments kind of as needed based on that feedback. And this is all leading up to the legislative session that begins on January 14th of next year. Next slide. So there are 5 different areas that I'll run through with ideas that we're looking at that impact certified centers. As I go through them, please feel free to write in the chat your thoughts, any questions or concerns, or if you think it would be helpful, that all of that information is helpful for us to hear. Next slide. So the first proposal would add behavior guidance and supervision to the required policies. So we all know you have to already train staff on these topics, and it kind of was an accidental omission that they weren't already listed in the required policies. So you can see there at the end of the bottom of the slide, it would be adding new language. The new language is the underlined text into 245H13 subdivision 8, adding subdivisions 9 and 10, which point back to the behavior guidance and supervision sections. And this would be effective August 1st if we went forward with this. The next idea relates to the facility requirements. So this proposal would require certified centers to have a minimum number of toilets and hand sinks. And this language would align with what's required already for licensed centers. And recognizing that this would may have a significant impact on some programs, having a delayed effective date, so it wouldn't be effective until June 1 of 2026. So on the next slide, you can see the language. I apologize, it gets a little small, so I'll call attention to it. So it would be adding this into 245H13 subdivision 5, and it would say that a certified center must have at least 1 hand sink and 1 toilet available for each 15 children or portion of 15 children being served. Hand sinks and toilets must be designated on the facility site floor plan, and any hand sink required for children must be in the toilet area. Like I said, this is matches and aligns with what's required for licensed centers, but we want to, get feedback from you guys of, do you think this is something that your program would have trouble coming into compliance with? Should the number look different for certified centers? Kind of any concerns or feedback you guys have on this language would be appreciated. And you can put it in the chat at any time, or feel free to reach out to Carrie or myself afterwards as well. The next idea relates to pediatric first aid and CPR. So it would be adding language to really specify what should be covered in the pediatric first aid and CPR trainings. Centers would be able to continue to offer those trainings in-house, so we're not requiring you to go through the American Red Cross or anything, but just kind of adding some more specificity about the topics that should be covered. And I just want to clarify, there's no change to the training frequency or who has to complete it. Next slide. So there you can see it would be adding a new paragraph into the first aid and CPR training section, and just specifying kind of what topics have to be covered. Again, CPR, choking, bleeding control, etc. And then it says that training developed by the American Heart Association, the American Red Cross, or another organization that uses nationally recognized evidence-based guidelines meets those requirements. And this would be effective January 1, 2026. Another potential proposal relates to language that Carrie talked about earlier about the conditional certification that passed earlier this year. So the language that passed this year allows a conditional certification to be issued. We missed the opportunity to also require that if a conditional license is issued, that it be posted in a conspicuous place within the facility. This aligns with the requirements for a conditional license and just kind of increases transparency for folks in the program. So on the next slide, you can see the language. So it just really spells out that if a conditional certification has been issued, they have to post the conditional certification in a place that is conspicuous to the people receiving services and all visitors to the facility for the duration of the conditional. And then if it's accompanied by a maltreatment investigation memorandum, that also has to be posted. So again, this just aligns with how a conditional license is treated. And then finally, there are a couple of pieces related to federal compliance. As you may know, Minnesota receives funding through the Child Care Development Fund block grant from the feds. Currently, Minnesota statute specifies that substitutes in a certified program must complete ongoing training in certain topics, but doesn't specify the number of hours. The Federal Office of Child Care, the OCC, conducted a site visit last year and determined that this was not in compliance with the CCDF requirements. So this year we'll be proposing a specific number that substitutes must complete a minimum of 2 hours of training each calendar year. So given the number of topics that they have to take, we believe that it should be no problem to meet that minimum of 2 hours, and that should satisfy the feds that we have a specific number. So there's no change to the training topics or frequency, just really specifying a minimum number. So on the next slide, you can see the language. There you can see in paragraph B, substitutes must complete at least 2 hours of training each calendar year. And I want to just point out that in A, those that are underlined, I think that's just from the hyperlink, and that's not new language. So just wanted to clarify that. Another piece related to federal compliance that John will be talking about a little bit more later on in this presentation relates to licensing information lookup. So earlier this year, the feds updated the CCDF rule and now require that all items that are reviewed at a visit have to be displayed that includes both areas of compliance and non-compliance. And right now, LIL, our licensing information lookup website, only shows areas of non-compliance and then links to a full checklist. So we're preparing a budget request for next year to support the IT changes that will be needed to LIL to come into compliance with the new CCDF rule. I see there are some questions about the toilets and sinks, and so just know that we'll continue on with the presentation, but we'll address those as we are able in the chat. So thanks, everyone.
Thanks, Karen, and thanks, Carrie. So we're going to move on and have John Sill. I'm going to unmute him. There you go, John. John is here. John's with the Provider Hub, and he's going to share some information for you about the Provider Hub.
Thank you, Lisa. Thanks, folks, for joining here today's webinar. And Lisa, special thanks to you for getting a real-time photo of me with that megaphone and that introductory slide. My name is John Sill. I'm the Provider Hub product manager. So essentially my role on the Hub side is just to make sure that everything is functioning correctly, provider facing. And then of course I work very closely with my partner in crime, Shanessa Schlattman, who is the Agency Hub product manager. So I think what we'll do is we'll get started and go through some of my slides here. So I included this slide just to kind of give everyone a reset and alignment as far as where we fall into play. It really helped earlier this month when I was at a conference to let folks know that although we have all these different work streams and whatnot going on through the service delivery transformation effort, all of these different work streams will be living with inside the hub, right? So where my work comes to play is within OIG, the product group. So I'm the Provider Hub, and I am also, I think about a month into my role, I was told that I will also be owning and managing LIL. So I was like, all right, let's get going with that. So I think what we'll do, we'll explore what Karen alluded to earlier in some of those new federal requirements that were introduced this year. So Lisa, next slide real quick. This is a slide that we like to provide folks in all of our different outreach efforts and change networks. This is our provider and agency solutions journey that we have been on. For this specific slide, I like to let folks to know where we are currently. So really the last big launch was ELS got launched in July 2024. So right now we are still preparing and developing what our family childcare provider launch will look like, which has been moved to next summer. And I don't know if you aren't aware, the family childcare launch will be a part of a phased approach. So we will start that phased approach visiting the 11 different regions throughout Minnesota, providing in-person training and support. I do want to let folks know that before that approach goes live, CCAP and use of funds report will go live within the hub spring of 2025. So right now we are actively working together just to make sure our messages are aligned between CCAP, Gray Star Compensation Fund, and the family childcare launch, making sure that folks aren't confused as when they will be going into the hub and when they won't. So this is kind of a quick snapshot of where we are at in our current journey.
John, can I jump in real quick?
Oh,
and just
sure.
remind, just as an assurance too, as all of those new things are being launched, there's continued development. So like for our certified childcare programs that were the first in the Provider Hub, a lot of those functionalities are continually being developed as well.
Yeah, good point, Lisa. And we, as our team has further been developed and expanded, we are continuing to iterate and try to make sure that we deliver something of value to folks. So we actually just combined two different development teams into one team, in hopes that we will be able to launch some enhancements or features for folks before next summer.
Great, thank you.
Yep. Okay, so what I was going to chat about today is just our licensing information lookup work that we are, are assigned to. So right now, the screenshot that you're seeing on the screen is just what LIL looks like in its current form iteration. Not a lot of different fields that you can search from, and there's not a lot of different criteria that you can filter or whatnot. So right now we are making sure that what the current functionality is in LIL will be transferable to the new LIL, but with some further features and enhancements. So we'll go to that next slide real quick, Lisa. Oh boy, this is so small. I apologize. So this is just a mock-up. So I do want to put this out there to folks that what you're seeing right now is just what we potentially will have the new LIL look like. We're still gathering feedback from all of our different stakeholders and continue to make some redesigns and put some more feedback and input where necessary. So the main changes for the new LIL is that you'll be able to search providers based on proximity to address. You'll be able to see folks view a map of those different providers. Providers will be able to add a bio and an image or a logo for their programs, and they'll also be able to post enrollment openings by age category. So that's what the current mock-ups of the LIL look like currently. And we'll go to the next slide here. And like I said, Karen alluded to this a little bit earlier. Oh boy, it's tough to see, but with the new Federal Office of Child Care rule and regulations that are going to go into effect for LIL, we will be displaying both violations and where folks are actually meeting the requirements that they need to meet. So the screen that you're looking at, it's tough to see, but again, this is just a mock-up of what our designers and our design teams have put together thus far as how to best show how folks can access this information. And again, like I said, we're continuing to get this in front of folks, gather their insights, feedback, input, and make some changes where necessary. We'll go to the next slide there, Lisa. That whole portion of the work where we are showing this to folks, that's really an effort in collaboration with our current user experience team. So it's a team of 4 folks on our service delivery or digital services team, and our consultants with Slalom. So they are continuing to put this in front of folks within Change Networks. They are doing interviews with individuals such as providers or licensors. They're gathering all that feedback and putting, making the necessary updates where possible. They are always, and I mean always, more than happy to chat with you all if you have questions, concerns, thoughts, or whatever. So if you want to be involved in this, what the new LIL potentially could look like, I mean, by all means, please feel free to reach out to me directly and I can connect you with those folks and they can get something set up for everyone to include with that feedback. And I wanted to put this slide in here. This is actually my manager, Elizabeth Adlin's favorite slide. What we always try to do is we try to ground ourselves in these specific values. So what our team is trying desperately to do is provide that transparency, collaborate with all different license types and work streams, listen to you all, and provide that continuous improvement and feedback and communicate what those changes look like. I started about 6 months ago, and although we haven't really hit the mark necessarily, we are trying to change that and deliver some more enhancements and features in a more timely fashion. So just know that when you reach out to our team, we are hearing you and we're trying to make those changes in the background to deliver that value. And this slide that Lisa's just went to is just how you can connect with me and other members of our team. So including that slide in there just for any questions that you want to send our way.
Thank you, John, for
Thanks,
those
Lisa.
updates about the Provider Hub. Again, a reminder, there is a handout posted. The link is in the chat for today's handout. as well as on the childcare or the Certified Childcare Center webpage that has links to more information. So you can do that. And John, maybe since you offered, you could also put your email in the chat.
You know it.
All
I'll put it
righty.
in
So
there.
I'm going to move on. We have Dana Ellingson today with us from the Great Start Compensation Program and features update section here of our presentation. So I'm going to unmute. Let's see, got to unmute her. There we go.
Thank you. Can you hear me?
I can. Thank you.
Oh, great. I got a little nervous. I couldn't unmute and then I remembered. I appreciate it. All right. So Dana Ellingson here from the Great Start Compensation Payment Program, a program specialist. We have an amazing team to support providers in the Great Start Compensation payments. So let's talk more about it. I'd like to use this slide here as a grounding slide first. To set the stage for what is the Great Start Compensation Payment Program in case you are not taking advantage of this benefit for your program. So just a little background that this application and this program is now being processed and housed inside of the Provider Hub, but it's a program that offers compensation payments to licensed and certified programs based on the hours of the staff that are working with children. And it's designed to increase that compensation and benefit to childcare workers and to support the childcare industry. And there are monthly applications that appear within the Great Start Compensation tab inside the Provider Hub. And it's on a monthly basis, and we process monthly. And when you, providers, complete that application that appears inside the tab, you agree to document how you're using the increased compensations or benefits to staff, again, that work with children. So the Great Start Compensation application, again, moving to the hub in July is when this happened for the first time. And our team has been taking that information in terms of what's working, what's the feedback, and working with the population and you individuals, some of you in those change network meetings, and appreciate the feedback to find out what else is needed. However, when you accept those funds, you're also agreeing to completing a use of funds report that will be completed inside the Provider Hub as well. So I wanted to give a timeline along the bottom, as this is important for us to know what's coming, when it's coming, that the use of funds is being developed as we speak. And as we work on that, we wanted to give more transparency into the timeline of when that'll go live. So on this slide in the bottom right, in very, very small print, just a reminder, it will be no earlier than spring of 2025 when that use of funds report goes live. Small print, however, we've been communicating with those inside the Provider Hub about information around this. I think it was in August, there was the first email that was sent out giving more information about this, but still we don't have the use of funds ready for you to complete. So no earlier than spring of 2025. In the next slide, we just want to talk about the why behind the use of funds, so we can give more transparency again to why is there a use of funds. One, you are documenting or stating that you'll document how you're using them, but it also gives us a report of the impact of the Great Start compensation payments to the field. It can improve the support for early childhood educators and the childcare industry. So you yourselves, we hope to improve our support in the way that these funds, understanding the way they are being used, and then also to ensure responsible use of funds in the state of Minnesota as well. So there's our why on the left-hand side, and if you go to the right side of the slide, just the new functionality that's coming out in this build for the use of funds, which is you'll be able to submit reports and view historical reports. So if you are accessing these funds, that'll be coming your way. You'll be able to see a historical report and also be able to update a supplier ID information, which also gives access to direct deposit for these funds. So that'll be also updated in the use of funds. You'll also be able to download multiple Great Start compensation payments records all at one time. Moving to the next slide, I want to give some more updates about the enrollment and attendance feature timeline. And again, inside of the Provider Hub at this time, the connection of enrollment and attendance feature is optional and free to use. And in the future, we'll have connections to that Great Start compensation application for certified programs. It's currently free. It's available. Some individuals use it as an optional kiosk for families to sign in and sign out at this time. But currently we're building the integrations with some childcare management systems to allow enrollment and attendance data to be shared. So instead of duplicating your work, using the childcare management systems that you're already entering to populate into the enrollment and attendance features that can be connected with your Great Start application. There's also some supports with or creation of bulk upload templates being built currently. And then in the future, again, that connection of the enrollment and attendance feature for the Great Start compensation application. Again, it is a requirement to keep enrollment and attendance information as it best suits your business currently, so continue to do so, but know that we are working with some childcare management systems currently as we continue this build. So the next slide is just a visibility into who we are currently working with, and that digital enrollment attendance is not required right now, but along the bottom, you'll see that that will be required in the future, and the vendors that we're currently working with are listed here based on information we gather from providers and also those that have the functionality to be able to do so. And we continue to have conversations with more childcare management systems in the future for future builds as well. That's what I have, but I want to keep an eye on the chat for any questions. Here, okay, and then I'll just answer into the chat. But thank you for the opportunity to share with y'all today.
Thanks, Dana. It's always good to hear about all the stuff that's going on, because there are so many people working on all of these different, the provider hub, as well as, the connection with the Great Start compensation program plan. There's a lot of people really working to try to streamline all of this for all of you out there, and it's always good to hear directly from them, since they're it's always good for us too, from the licensing and certification side, to hear directly from them so that we're able to best support you when we're out in your programs or connecting with you. So thanks to Dana, and I'm going to unmute our friend here. Let's see, I've got Jana Nicolaisen. She is a Research and Operations Area Manager with the Background Studies Division at DHS, and she's going to share some little background study requirement reminders and information. So Jana, take it away.
Yes, hi everybody. Thanks for having me again. Jana Nicolaisen. I manage our research and operations area in the background studies division at DHS. All right, so next slide. All right, so I thought I'd start off with kind of the meat of it, childcare study requirements. So all individuals affiliated with a licensed or certified childcare center must complete a background study every 5 years. So to comply with the requirement, new studies must be submitted and should be initiated no more than 90 calendar days. So about 3 months, give or take, before the study's expiration date. You can use your provider roster in NetStudy2 to check expiration dates. So I have my next few slides are just still shots of NS2, just to orient you or as a gentle reminder on how to do that. So next slide, please. So this is the provider roster page in NS2. So you can go in, there's lots of different filter criteria, and you can view your roster in that way. Next slide, please. This is a little small, however, when you get into your provider roster, you'll be able to see everyone's name and then probably the determination. So, where they're sitting and then when their determination expiration date is. So that's one way to look at it as well on the roster page. Next slide. And then probably the one that's most important is this new background check needed. So that is where you will be able to go on to the NS2 page, click on this, and then you are able to filter and look, and you'll be able to see in the blue box and then below that if studies are expiring or near expiring and how to submit. So those are just kind of the basics. There's always helpful videos and work aids in NS2 as well, for people to look if they wanted a more interactive process on how to check rosters and look for a new study. So, all right, next slide. Okay, so again, reminder to check rosters. I'm sure you hear this all the time, but every time we're in front of a group, it's always important for us in background studies to remind people to check their rosters routinely. They need to ensure that studies are compliant and up to date, and that people who are no longer affiliated with the program should be separated from the roster. So it's important to go in on a regular basis to make sure that your rosters are accurate and reflect who is actually affiliated with your programs. Next slide. All right, and then just some basic background study updates. So DHS will continue to cover childcare background study and fingerprint fees through December 31st, 2025. So a whole nother year and a few months. So this includes household members or anyone affiliated with the childcare program. All right, IDEMIA fingerprinting concerns. So I know this was one that was brought to me to address. So yes, we do have a number of concerns that happen. We meet with IDEMIA on a weekly basis to discuss issues. I will say we're always interested in ways to improve fingerprinting services, specific feedback about a location or a specific study subject is helpful when you are reporting any issues, so we can follow up specifically with IDEMIA on that. And, you know, we're just constantly working with IDEMIA. It's hard for them to keep staff. It's hard to, some of these areas that either have a lot of volume or it's just, you know, they're located in a less populated area. We understand the impact when one of those fingerprint sites go down, the impact it has in getting those fingerprints in a timely way. So we are just, you know, constantly taking in that feedback, working with IDEMIA, and just trying to troubleshoot some of those, you know, issues as they come. But I would suggest, you know, if there are specific concerns, make sure that we're reaching out, and we always bring those back to IDEMIA to address behind the scenes. So I will say that. And then I think the other piece was contact center phone, email, and wait times. So I know people are probably experiencing longer wait times and probably email responses than they have in the past. We have a number of you know, factors that have contributed to that. So our average calls per week average over 750 calls. So we have a small team of about 6 that are you know, tasked with taking calls and responding to emails during the week at our contact center. And I will say our emails are over 1,300 a week that we're responding to. We have had new staff come on. We've had, you know, an expansion in our area. And so we've had staff move on and had to bring in new staff to train. So some of this is, you know, just getting staff trained, making sure they're understanding the information they're providing, they're doing it quickly, as well as giving, you know, the correct information. So the quality of the information someone is receiving is accurate as well. So we do acknowledge that there has been longer wait times, and we are actively working on that. We just have had increases in volume paired with newer staff, and it's creating, you know, a little bit of a, you know, headache on the user side. So we're aware of that, and we are working and using the data that we have continuously to make sure we're trying to get to everybody during the times that we are open. So next slide. And then I think that is it. So I will add this in. So our contact center, again, limited hours of operation. That's again due to staffing. So we are open from 10 to 3, phone number, email address. And then we have the childcare background studies webpage. I will link all of that into the chat as well as people go through. And then I also think I know there was a few different questions that have come in. So I will respond to those directly in the chat.
Yes. Well, I want to say thank you for your transparency and for all of the efforts that you and your team are making to really make connections and get all of those calls and emails answered. So we do appreciate you, and we also appreciate you coming often to our, any opportunity we offer to you and the Background Studies Division, because you are a fan favorite to hear from. So
Me personally, that's great. I just met you all, but I'll take
you
it
and your
personally.
team. It's always fun,
Okay.
and it's always good for all of those that we serve at DHS to see. There's many people in different areas that are working to kind of like provide these support and services to our certification holders as well as our license holders. And so we all do work very closely and try to support each other in all of these efforts. And as you can see through today's presentation, a lot of feedback that our licensors bring back from your programs does get filtered to our partners. And so I do again really want to thank all of those our partners that are here today to share that information and be very transparent with you on the work that they're doing and moving forward to support you all better. So thank you. I'm going to move back here to our Child Care Center certification team. We've got Michelle Hatlily, who I believe I just unmuted Michelle. And Carrie, I'm going to unmute you as well, just in case you would like to add anything, and I'm going to do that there. So let's see, do I have Michelle? Michelle's unmuted. Michelle's going to share with you some information, some reminders about your child care certification. So thanks, Michelle, and take it away.
Perfect. Can you hear me?
I can hear you. It's the closer you get, the better.
Okay.
Thank you.
Okay, sounds good. All right, I'm Michelle Hatlily, one of the certification licensors on our certified team. I'm just going to go through a few reminders for you all. Lisa, if you want to just switch the slide real quick. The first thing is in regards to allergy information. So when you have a child with an allergy, this is any type of allergy, you must get all the required information regarding that child's specific allergy. So that includes the description of the allergy, the triggers, avoidance techniques, symptoms, procedures for responding, medication dosage, doctor's contact. All of that allergy information needs to be collected. And then staff need to be informed of all of that information, and then it needs to be documented that they have reviewed it. Now, when they are signing off on it, just making sure that their signatures are legible, so licensors can read their name, and then that they are also documenting the date that they reviewed that allergy information. And then food allergy information needs to be kept wherever food is served and prepared. Now, this includes all those required things that I listed just a second ago, not just the name and the allergy. It needs to include the description, triggers, avoidance technique, and so forth. DHS does have a form that has all the requirements where you can use the form. It's not required, but it's on our website if you want to use it. The next thing that I'll just briefly talk about is supervision. We have recently received several investigations regarding child-to-child inappropriate touch. We do investigate these as supervision concerns or allegations. So licensors will go out to programs and conduct an investigation regarding supervision. So some things that we just want you to consider thinking about in regards to this are what is the history of the children in your program individually and between each other? What are the age differences between the children in your program? What does your risk reduction plan entail? Should it be updated? And then ensuring that staff are trained on the risk reduction plan and supervision. And then the last thing that I want to remind everyone is that making sure that they are updating their hours of operation in the hub And that if you're unsure how to do this, there are instructions on how to do that. There's a knowledge article out there called How to Request a Change to Your Hours. So just making sure that's updated in the hub as well. So really, that's all I have for just quick reminders. If anyone has any questions, pop them into the chat.
Thanks, Michelle. And with that, we do have extra time. So I do want to remind you, we have a team of panelists here from all of these different areas that all are here, and they will stay on to answer questions that have come up in the chat. And I would like to invite any of them to let me know, although I'm not sure I will be able to unmute you all until I know how that you need it. There were some functions with WebEx that changed, so they were supposed to be able to unmute themselves, and now they can't. So anyways, if they would like to be invited to actually share something verbally, try to let me know and I will try to unmute you. Otherwise, we'll stay on, continue to answer in the chat, but we want to thank you all for your time, for signing in here today. Also, if you think this is a valuable format, please share that information with your licensors so they can bring it back and we can, determine if this is something we want to continue to do in the future by offering these outreach webinars so that we can touch base, offer you information or kind of, solidify information that we're already sending out via emails through our Gov delivery. But, just kind of, again, another way to kind of reinforce it and allow you the opportunity to ask questions. So we just want to invite you to do that as well. Otherwise, we want to thank you all for being here. Have a great and amazing afternoon. And as always, thank you for all you do for the children and families of Minnesota. We do appreciate that. We, as much as we have this partnership here internally, we all very much appreciate the partnership we have with each of you in doing that, in serving the children and families of Minnesota. So thank you. I'm going to look to see if anybody has requested for me to unmute them. I don't see anyone. But again, we'll stay on in the chat. Thank you so much. We appreciate you. Have a great day. Carrie, I have unmuted you if you're interested.
Yeah, hi,
Michelle.
thank you, Lee. Can you hear me?
I can now, yes.
Are you getting a strange feedback?
Should I unmute you on Karen's?
Yes, yes, please. Can you hear me
Okay.
now?
Yes, I can.
Okay. Thank you. So as far as the immunization goes, what we are asking you to do is to come up with a plan on how you could gain access to those. So I was having a little computer issue, so I'm reading through all of them right now. So yeah, so reading through these, you would need to come up with a plan on how you could get access during all hours of the operation. And what that plan will look like is something that you can create.
Thanks, Carrie.
You're welcome. Still reading through some of these questions, but
I'll leave you unmuted for
that's
now.
helpful.
I know too, there's, let me see how many participants we still have. 16. So there are, I'm pretty sure it's the same 16 that are maybe waiting for an answer or waiting for more. We had multiple sign off already though, so they won't be getting the answers.
So I'm also reading one right now that saying the district will not allow you to print the immunization records. That is not a requirement that you necessarily print them, but again, just have a plan on how you could get access to them during all hours of operation.
Carrie, there is a question now that asks about if it needs to be written, the plan needs to be written somewhere and of who has access. Or just
No,
something.
the plan does not need to be written anywhere. Just when a licensor comes out on site, they might ask, what is the plan and how will you get access?
And then do they need to get that access or just share that plan? Sorry.
Are there any additional questions? And if not, we will go ahead and wrap up today.
Okay. Sounds good, everyone. For the couple that are still here, you know, we can always find information or how to reach us, either via your licensor or our Certified Child Care Center licensing webpage, where we do try to ensure that we have updated information on our webpage, so as well as our contact information. So you can always contact our division or our licensing unit and certification licensors in that way as well. So thanks for being here. I think everybody's signing off now. So we're going to sign things out and have a great afternoon, everyone.
Thank you. Thanks.